Welcome everyone to the Fecal Incontinence campaign. I'm Dr. Dorothy Drow, a general surgeon, and in this video we are going to focus on patient perspectives. Our very special guest today is Mary Lynne van Poelgeest-Pomfret, who is an international patient advocate, chair of several societies, such as the World Federation of Incontinence and Pelvic Problems. Well, welcome.
Hello, Dorothea. Thank you so much for inviting me. It's a pleasure for me to be here and to tell you a little bit about WFIPP, the World Federation for Incontinence and Pelvic Problems, and myself. In fact, I'm the president of the federation. It's a federation of national patient and other organizations. And indeed, as you say, we work very closely with the scientific societies in a collaborative approach with the view of representing the patient perspective and being the patient voice for all matters relating to incontinence and related conditions. Recently, in fact, we now have focused on the men as well, so we have prostate cancer within our scope. One of the things which I'd like to say is that during World Continence Week, which is an awareness-raising campaign for incontinence to reduce the stigma and taboo associated with all forms of incontinence, it really is so important for everybody to work together. And hence we started about 2 years ago collaborating closely with the scientific societies like the European Association of Urology, the International Continence Society, ESCAP, the Colorectal, and IUGA, CNUG, many of the societies. And it's actually producing fruits, so to speak. One of the big projects that we have at the moment with several other stakeholders is the shared decision-making program that we have, and that is now going to become an entire project together with the EAU, the ICS, CNUG, and we're very excited about it because this is going to result in a patient-reported outcomes, a PROM study, which will be, how should I say, the WFIPP will play a major role as the patient voice.
That's great. I'm very happy you mentioned studies and scientific work, and looking at the current guidelines, many of them have represent very low evidence due to the lack of numbers. Do you see the society and your particular work as a tool to increase these numbers, to gain more knowledge?
Very much so. There's already an ongoing campaign you may have heard of. It's called the Urge to Act, which has been supported by the European Association of Urology and ourselves and other stakeholders. This is a major campaign which for the first time has documented real-world data on incontinence. And I would literally urge everyone to take a look at that. It's the Urge to Act campaign with facts and figures. If you don't have facts and figures, then forget it. That's number one. Before you do anything else, you need to know what the facts are, and then only from then can you start to extrapolate and deal with other issues.
Yeah, I completely agree. And you and the societies, and which tools do you use to reach these patients, and how do you use social media, and do you think it has a major role in it, or what's in your toolbox?
Well, in our toolbox are lots of wishes and wants. As I say, we can ask, and we do ask. We do a lot of lobbying, also at the political level. I do a lot of work in Brussels with the European Union, lobbying for these campaigns. One of the other aspects, I'll answer your question in a moment. One of the other aspects is sustainability and the Green Deal. And if we look at incontinence and the amount of waste products that are produced, for example, absorbents, just take absorbents, in some countries it accounts for 10% of landfill, which is huge. And we really want to reduce that mountain of waste. So that's one of the projects that we have. And as I say, again, from the financial and the effectiveness point of view, that is also key. For us, we're a very small organization as such, but we have a lot of, how should I say, influence as being the main global platform to represent the patient perspective. So what we do and what we try and do is via social media campaigns like World Continence Week, we really try to get at the core of many of the issues that are very prevalent today. As I say, stigma, taboo. One of the main topics this year is incontinence and mental health, which again is a huge issue. And to do that, we need Big Brother, like the scientific societies, to help us so that we all work together. In fact, it's not sort of working in silos, but that we collaborate and pool our resources.
Although you're present worldwide, are you more present in certain areas or countries?
Well, yes, we're more present as yet in Europe. I live in the Netherlands, so it's easier to be within Europe. But we do have representation in all continents, but it's not enough. We need to expand and we need to grow, and we are growing exponentially, basically. But of course, to do this work, you need the means to be able to do it. So you need the human resources, you need the financial resources. But to the average individual, what matters to the patient is the quality of life of a patient or family, caregiver, whoever. And that's our role. That's why we exist. And we need help and support.
Of course, I think it's a common aim. As ESCP, how do you see and what are your goals in terms of collaboration with our society?
I would very, very much like to have a good collaboration, endorsement, and a proper founded collaboration with ESCP. Definitely, as we have with the EAU, the ICS, and CNUG, and that's next on my agenda. I like to tick the boxes when these things are done, and then they just sort of self-perpetuating. But that's very necessary to have the colorectal context within the WFIPP. At the moment, it's far more on urinary incontinence, but of course, we represent also people with fecal incontinence.
That's very nice. I completely agree. Could you set a couple of examples where we could specifically proceed with our collaboration?
Well, I think number one is to maybe sit down and have a few calls and get together either virtually or physically and see perhaps maybe if I come to the conferences, and then we can arrange some meetings, practical steps. I think that's the immediate next step, so to speak. And because we have projects and stuff that we'd like to share with you as well, and vice versa. I'm sure you have too. But and then have the patient cohort within the organization, within the scientific society. I think this would be good for you too.
Oh yeah, absolutely. I think we talked about associations, collaborations, but as a patient advocate,
Yes.
can you talk a little bit about patients' expectations and things that are important and the society should focus more on? What do you think?
Well, one of the big projects that we have at the moment is the shared decision making. Everyone's talking about shared decision making, and I think we could work very closely with you. We already have some modules and information. We have projects, and I think it would be very good to bring that to the table so that we can actually see within the fecal incontinence aspect how we can work on that to get a better deal, let's put it this way, for both the doctor-patient relationship and enhance that. And as I say, we've got the tools already, so it's a question of matching your needs and our needs, so to speak.
Oh yeah. And do you think patients can help each other? And could the
Yes.
society be of help to these people, and how?
Yes. Well, first of all, we have our own member. We're a federation of patient organizations, so we have national patient organizations, so they in turn work within their own countries to help patients, so to speak, and where the umbrella who comes with the various projects at sort of global level, at umbrella level. So in turn, it filters through from us to the national organizations, and they in turn have their own fora and social media and patient facilities, let's put it that way. So it's a sort of filter process, basically.
Great. Thank you so much. It was really nice meeting you, even online.
It's nice meeting you. We're a long way off, I think.
Thank you very much. And
You're very welcome.
About collaboration, I really hope to see you our upcoming annual conferences in at
Yes.
the
Yes, that would be a very good opportunity. Thank you so much.
Thank you very much.
Bye-bye.
Goodbye.